So talk to us about the O shot injection.
So the O-shot injection essentially is PRP. So PRP is platelet-rich plasma. So this is that part of your blood that helps you heal, that helps bring collagen, bring stimulatory growth factors to a specific area. This has been used by different specialties. I think the most notable are the orthopedic surgeons or the orthopedic specialists, where they utilize platelet rich plasma as a way to reduce the need for surgeries, to improve physical therapy and mobility without going through a major surgical procedure. So is the PRP is used in the same way in the genital area to bring those growth factors, stimulation things to the area to help improve the function. So it is given or applied to the clitoral area and also to the anterior vaginal wall, so the area where the G spot is. Now, this, of course, when I first describe it to people, the first thing they say is like, "Ooh, yeah, a needle down there? I don't think so." But is the technique that has been honed in on by Dr. Ronald, who is one of the main people that will train providers on how to deliver this, really offers the best in terms of comfort. Testimonials from patients is, I really didn't feel like you were doing anything, is was not painful at all. It was not what I expected. And the overall experience for the procedure itself has been wonderful. And truly is that the from time of starting the procedure to the end is no more than 20 minutes. So it's a very quick way to, I think of it of taking good stuff from one part of your body and directly putting it in the other part of your body. It's similar to women that are trying to conceive and have had some difficulties, that they go to a reproductive specialist for an IUI or intrauterine insemination. Essentially, it's the same egg and sperm that we're trying to get together, but you just get that sperm, get it into its concentrated good form, and then put it closer. So this is what we're doing, is we're just getting all the good stuff and we're putting it in closer to where it needs to work.
Excellent, excellent. So who would be a good candidate for an O shot injection?
Truly, it's anyone who is looking for any improvement. And the O
Mhm.
shot, some people call it the orgasm shot. It really is not just that. So this is like any treatment option that is bringing growth factors and healing components of your blood can be used for any genital abnormalities. So this has been studied in people with medical conditions like lichen sclerosis, people who have mild urinary incontinence that do not want to undergo major procedures like a sling or bulking procedures, is that they have shown some improvements with this as well. People who have vaginal discomfort with intercourse related to different things like scarring and all of these things have used this also with some improvement. So truly is anyone who is looking for an improvement in pain and discomfort, sexual related or otherwise, it really does help with a wide range of things. But it does, when you're putting growth factors in your most sensitive area where all of your nerves are and things like that, is that there has been an increase in the performance. And that's the thing is, again, the stigma with a lot of these things is like, oh yeah, I don't have a problem in that department. Yeah, I'm okay. But is things change over time. And you may be a time in your life that instead of an ooh, you want to ooh, ooh, ooh. So is that this
Mhm.
allows you to get additional satisfaction, basically.
Oh, I love that. And I think, like you said before, a lot of times we are always making sure that men have an option to make sure they're getting maximum satisfaction with their performance. And
Yes,
yet we don't do the same, making sure women are having the same satisfaction with their performance.
that's correct.
And I find that, that is one of those patriarchal things where sex is supposed to be so fun and enjoyable for men,
For
and we
men.
want to make sure they have all the tools to make sure that it's so fun and enjoyable and satisfying. And women, it was kind of like, you know what, It's for, you're there for our enjoyment and
That's,
not the other way around. It was never mutual. That messaging was never mutual. We're
yeah,
here for each other's enjoyment and maximizing that. And what does that look like and feel like in terms of intimacy along with the physical pleasure?
yeah,
And so I'm glad that there's, starting to have conversations about those things so women who choose to can elevate their feelings of not just well-being but also feelings of satisfaction during those physical and mental, emotional, intimate acts. So I want to talk to you because you mentioned it when we were having a conversation earlier on. Talk to us a little bit about minimally invasive gynecologic surgery. While this
yeah.
isn't necessarily the focus,
I
I really do like to talk about things that are minimally invasive because surgery is not for everyone.
yes,
I definitely don't recommend it for everyone. However, I also say I want to support you in whatever decision you make.
yes,
And so some women want to have a surgical intervention, even if it means to, have a blank slate so they can start over again with some of the things that we've talked about, or they
yeah,
feel they don't have the tools or the energy or fill in the blank XYZ to do so on their own, and they want to have that surgery so they can start again or begin again. So talk to us about minimally invasive gynecologic surgery
yeah.
and what it means to be have that as your focus in your firm.
Oh, I love, love, love this topic. I was about to ask you, how much time do I have? Because
You have all the time. I want you
pull
to
up
talk about
a
it.
blanket and just lay back.
Yes.
I love this topic, and truly, this has been my passion from the very get go. From the first time I had my first experience with a GYN patient as a medical student in an emergency room, it became my passion to make sure that all women are aware of all their choices and it's not limited to the privileged few. There's some
Yes.
people who do not know all their options and that it's available to them. Is you don't need to have a specific type of insurance to get a certain type of procedure. You don't need to live in a certain part of the country to get a certain type of procedure. So I have invested my time, my efforts to make sure that I am able to offer a full range of service for my patients. Saying that is that I focus a lot on problem solving. My practice currently is a referral based practice. So is I get a
Mm-hmm.
majority of patients from other gynecologists and primary care providers in the area to solve a problem for a patient. So by the time most patients are coming to me, they already know that they're at that surgical point. They have spoken about all their different options and their medical interventions, given time and all that. So they're coming to me with for a surgical solution. And when we talk about the surgical solution, is that people seek second opinion. And they have gone to other providers that will say, yes, well, you have uterine fibroids. You are in your 40s. I doubt you want to keep your uterus. Don't keep your uterus. You need a hysterectomy. And by the way, that hysterectomy that we're going to do, it will be best for us to do it open because your uterus is too big. By the time they come to me to speak to me about all their options, some women don't want to have a hysterectomy. It is the definitive surgery for a lot of different GYN conditions, but it is not what is always best for that patient. Again, shared decision making. So saying that is being able to offer alternative management to a hysterectomy, especially when dealing with uterine fibroids, which we know in African American race, up to 80% of us have it. In Hispanic race, up to 70% of them have it. Saying that is being able to offer these surgeries minimally invasive that women are able to get back to their day-to-day activities, taking care of families, taking care of communities without that extended downtime and increased risk for complications like deep vein clots and wound infections and wound separations and things like that really has been my passion. So for things like uterine fibroids, first, your options really depend on whether you are choosing to keep your uterus either for fertility reasons or just because you want it, or whether you are done with your uterus. If you are, definitive surgical management is a hysterectomy, so removal of that uterus with those fibroids will solve the problem permanently. It's not going to come back. But for those who want fertility related treatments or just want to keep their uterus, depending on the position of the fibroids can have different positions. Depending on the position of the fibroids, Options can include a hysteroscopic management, which means no incisions on your abdomen. You're going in through the cervix with a camera and using different instruments to complete that procedure. You have
Right.
option for myomectomy, which can be done either laparoscopically or robotically assisted, going in through small incision, or even surgical procedures known as a laparoscopic assisted abdominal myomectomy, where you do go in by laparoscopy to help you envision the pelvic structures, but at the same time making a very small incision in the lower part, a mini laparotomy, to complete the procedure that way. And then there are things that are not been studied well in people who desire fertility. The laparoscopic radiofrequency ablation, also known as the Accessa procedure, that is an option to ablate or to destroy that fibroid so it changes form and changes activity. And then for people who don't want any fertility, and depending on the type of fibroid that you have, you can do a uterine artery embolization. So is minimally invasive surgery, comes in all different shapes and forms, is that there is really no reason at this point, in my opinion, my humble opinion,
Yes.
aside from or suspicion for cancer or precancer, or a surgical complication during a minimally invasive surgery, for you to end up with a big open scar. I've seen
Right.
people, who've come still with their ovaries and they had a scar up and down this way. Oh, yeah, they told me my
Hmm.
uterus was so big they had to do it that way. No, is that you don't have to do it that way. There are different options that you
Right.
have. And when it comes to issues like pelvic pain, chronic pelvic pain, which is a whole other topic on its own, we do know that endometriosis is a very, very common condition that is really underdiagnosed, and many
Hmm.
young women suffer in silence because they're undiagnosed. Having minimally invasive surgical routes to diagnose and potentially treat the condition is something that people didn't know existed. And in a lot of these surgeries done in higher level institutions where you have great systematic, what am I trying to say, structures that take care of
Hmm.
people, protocols that we keep you safe, undergoing those type of minimally invasive surgeries comes with it a really, really low percentage for harm or for complications. So you are
Right.
able to get your diagnosis, get your treatment plan based on a confirmation of a problem rather than an assumption of a problem.
Wow, I love that. And I love that there were about seven or different, even inside all of the different types of surgical interventions, even if it's not someone's first choice, they still have options within that choice,
That's
what
correct.
is right for them. And I have seen so many different women who have these horrific scars. And I'm, even talking about that brings some emotional or post traumatic stress because it's a constant reminder of something that they may have had. Sometimes the fibroids come back. They're like, why did they tell me they were going to come back? And now I still have this scar. And now I have to deal with adhesions. And now I have to deal with this. And I have to deal with all those things.
Yes.
And that scar is not just a physical mark on one's body, but it's also a mark that reminds you of something that you were trying to get away from that's still not resolved, and it's ongoing. And I find that that is one of the most unfortunate aspects of gynecological surgery, or that so many of my patients and clients are facing because they don't know that there are other options, or they don't know that they can do certain things without having insurance.
Yes.
um, and it's painful because that affects how they move forward in every other interaction, because it's a level of distrust. It's a level of, am I making the right decision? If I don't do this, then what happens next? And it's a lot of second guessing in terms of the decision making process and what those results are actually going to look and feel like 3 months from now, 6 months from now, 12 months from now. And am I going to have to do this again? And
Yes.
I find that that's so frustrating for so many women. It's costly. It's not just the physical and the financial toll, but it's also that mental, emotional toll that so often goes unnoticed.